Unit 16 test question 1. A nurse is planning to teach a client with a left arm cast about measures to keep the left shoulder from becoming stiff and frozen. Which suggestion would the nurse include in the teaching plan? 1. Lift the left arm up over the head. 2. Lift the right arm up over the head. 3. Make a fist with the hand of the casted arm. 4. Use a sling on the left arm. Answer 1. Lift the left arm up over the head. 2. A client has a fiberglass cast applied to the lower leg. The client asks the nurse when the client will be able to walk on the cast. The nurse replies that the client will be able to bear weight on the cast. 1. Within 20 to 30 minutes of application. 2. In approximately 8 hours. 3. In 24 hours. 4. In 48 hours. Answer 1. Within 20 to 30 minutes of application. 3. A nurse has given a client with non-plaster leg cast instruction on cast care at home. The nurse would evaluate that the client needs further instruction if the client makes which of the following statement. 1. I should avoid walking on wet slippery floors. 2. It's okay to wipe dirt off top of the cast with damp cloth. 3. I am not supposed to scratch on the skin under the cast. 4. If the cast gets wet, I can dry it with a hair dryer tan to the warm setting. Answer 4. If the cast gets wet, I can dry it with hair dryer tan to the warmer setting. 4. A client with a hip fracture asks the nurse why buck extension traction is being applied before surgery. The nurse response is based on the understanding of the buck extension traction primarily. 1. Provide rigid immobilization of the fracture site. 2. Provide comfort by reducing muscle spasm and provide fracture immobilization. 3. Lengthen the fracture leg to prevent severing of the blood vessel. 4. Allows bony healing to begin before surgery. Answer 2. Provide comfort by reducing muscle spasm and provide fracture immobilization. 5. A client in skeletal leg traction with an overt frame is not allowed to turn from side to side. Which action by the nurse would be the most useful trying to provide skin care to the client? 1. Ask the client to lift up by digging into the mattress by unaffected leg. 2. Push down on the mattress of the bed while administering care. 3. Have another nurse the client anyway. 4. Ask the client to pull on the lift up the hip of the bed. Answer 4. Ask the client to pull up on the lift up hips of bed. 6. The nurse is evaluating the pin side of the client skeleton traction. The nurse would be the least concerned which of the following findings? 1. Purulent drainage. 2. Serous drainage. 3. Pain a pin site. 4. Inflammation. Answer 2. Serous drainage. 7. A client immobilized in skeletal leg traction complaints is being bored and restless. Based on these complaints, the nurse formulates which of the following nursing diagnoses for the client. 1. Divisional activity deficit. 2. Powerlessness. 3. Self-care deficit. 4. Impaired physical mobility. Answer 1. Diversional activity deficit. 8. A client has buck extension applied to the right leg. The nurse would pain which of the following intervention to prevent complication of the device. 1. Massage the skin of the right leg with lotion every 8 hours. 2. Give pin care once a sip. 3. Inspect the skin on the right leg at least once every 8 hours. 4. Release the weights of the right leg for range of motion exercise daily. Answer 3. Inspect the skin on the leg least once